go, let's go now. Go get your job. Go, let's go now. Go get your job. Go get, go and get your job. Go get, go and get your job. Bye bye Corona. Bye bye Corona. Get your job. Bye bye Corona. Bye bye Corona. This message is brought to you by the National Primary Healthcare Development Agency, NPHCDA. Welcome back. It's still COVID Talks on Omega 101.7 FM and Mount Radio, your radio. And this morning on the program, we're looking into COVID-19. Well, for if you're taking notes, this is week 12, COVID-19 vaccination, and the vulnerable emphasis is on vulnerable persons. And you just might be wondering, who are the persons regarded or described as vulnerable? I'm talking about persons with disabilities and the elderly. We want to know ways which or measures that were taken to encourage them to actually take the COVID-19 vaccination. And we have on the other side Mrs. Nkechi Onvunka. She is our guest this morning, and she'll help us with the COVID-19 vaccination and the vulnerable persons. Let's get connected with her right now and get into the conversation. A very good morning to you, ma'am. Hello.
You're welcome.
All right, you're welcome to the last day in the month of September. We're excited. We made it into the last day in the month of September. Okay, into the conversation this morning, we're talking about COVID-19 vaccination and the vulnerable persons with disabilities and the elderly. Well, before you delve into the conversation proper, because we want to know how they have been encouraged to take the vaccination, we understand that the COVID-19 pandemic has disproportionately affected older adults, people with disabilities, and people with underlying health conditions. Also, older adults are at a higher risk or highest risk for severe illness and death due to COVID-19, and people with Down syndrome and intellectual and developmental disabilities are also at a higher risk. And that stated this morning, I would want to find out from you this morning, what ways were you able, or in what ways have you encouraged them to take the vaccinations this morning? Hello? All right, let's get reconnected. Can you hear me now?
Yeah, I can hear you now.
Okay, so let's get to find out from you. How have those, because our focus this morning, as I stated earlier, was COVID-19 vaccination and the vulnerable persons with disabilities and the elderly. How have they been encouraged to take the COVID-19 vaccination? Over to you, Mrs. Nkechi.
Good morning.
A very good morning.
The moderator.
Yeah.
Yes, I am Mrs. Nkechi Onwuegunta, the State Immunization Officer, Anambra State. Yeah, your question came at the very right time. We needed to address the issue and to get it clear, among the public, the situation on ground as it concerns COVID-19 vaccination and the vulnerables. It's just the right topic at the right time, because we are still doing a massive campaign, vaccination of our people 18 years and above for COVID-19 disease. So vulnerable people, who are the vulnerable people? Vulnerable people are the people that are most likely to be affected by a particular condition. And in this respect, as it concerns COVID-19 infection. So vulnerable persons in the COVID-19 language means people that are the elderly people, the aged people, and then The people with some disabilities or with some underlying diseases like hypertension, they are the vulnerable people in as far as COVID-19 vaccination is concerned. So how far have we been, have we been getting on with these people?
Yes.
Yes. It hasn't been an easy journey. It hasn't been an easy journey in the sense that COVID-19 came with a lot of, rumors and myths, which we are still battling with. At the onset of COVID-19, as the name implies, COVID-19, which hit the world in the year 2019.
Yeah.
The world was kind of thrown into confusion and pandemonium. And that being the case, most people were confused, especially when we were told within the shortest possible time that the vaccine has been produced. People became more confused, coupled with the rumors on ground.
Sure.
And nobody, most people were rejecting the vaccine, including the vulnerable groups. Initially, when we started this exercise, the Federal Ministry of Health, in collaboration, the National Primary Healthcare Development Agency, in collaboration with the Federal Ministry of Health, they categorize the stages of vaccination, like the frontline health workers will vaccinate first, the health workers, the police people, those that are having a contact relationship with different groups of people from time to time. So it was categorized under 4. But with the situation on ground, are people not responding as they ought to? Everybody 18 years and above, we started vaccinating everybody 18 years and above. So vulnerable people are not different from other group of persons. They are also among the society, and they are also humans and living within the society. So and are affected by the norm, by the ideas and conceptions of people around them in the society. So they were also part of this group that were afraid to take COVID vaccination. So how far have we been getting along with them?
Yes.
We've been getting along with them just like every other person as I'm airing this message through social media, through radio, through community dialogue, through sensitization, through visitation of the traditional and religious leaders.
Hello?
Various groups. Hello?
Okay, I can hear you now. I can hear you.
And various leaders in the various groups. We have been getting along with them through the air, communicating them through the air as like we are doing now. Yes. Communicating with paying advocacy to the churches, to traditional leaders, to leaders of corporate bodies and market leaders, market union leaders, women leaders, youth leaders. We've been going on various advocacies, to be able to dispel this rumor that COVID-19.
Hello?
It is so hard to, hello?
Yeah, I can hear you. Though we're having interruptions. But go ahead.
It's hard for our people to accept the truth. But the honest truth, which I keep saying and which I'll keep saying because I know is the truth, is that COVID-19 vaccination is safe. It's safe for everybody, whether you are vulnerable or you're not vulnerable, but more especially the vulnerable group. Why? Because in the vulnerable groups, the elderly, their immunities are very down. When one is aging, so many things go along with it. True. The immunity level is reduced.
True.
One, the rate of the rate at which the person feeds reduces. Another thing, the systems are getting weak. All the organs that started work at birth are all getting weak, including the digestive system. So the immune system is very down. That being the case, they are, COVID-19 disease operates more where the immune system is down, and it will go and bring it lower again, leading to so many complications and the health challenges.
Okay. Go ahead, I can hear you.
So we've been getting along with them in so many forums. We visit them, women at their women August meeting. We talk to them on this COVID vaccination. But the sad thing about all this is that our people are still not convinced. Unless when they want to travel abroad, you will see them want to take, they'll be looking for vaccine everywhere. They will be, if they know your number, they'll be calling you on phone. Where can I get COVID? Then the person will not know again that COVID-19 vaccine does this or does that. Because now he wouldn't be allowed to travel outside the country where others have taken it. So a speech in time, they say, saves nine.
Yes, it does.
Yes. I strongly advise our people to do the needful at the right time.
Okay.
It's not because government is giving it free of charge. It's not supposed to be free of charge. It is costly, very, very costly in different parts of the world. Very costly. Only that here in Africa, because of our continuous, low, financial imbalance.
Okay.
We continuously need assistance from the international world or international communities. So they subsidize this drug in the manner that we don't pay for it. The drug we are thinking is free. It's not free. Someone else has paid for it. And that is why it's coming to us free. And there are people are thinking because it's free, it's giving free of charge, maybe it's not a good one. These are people how they think. Once something is not too difficult for them to assess, they will think that there may be something behind that thing. So my people, I encourage all of us, whether vulnerable or not vulnerable, to go out, avail yourself the opportunity. Because time is coming when all these vaccines may not be given free of charge. Yes, when the people that are paying for it removes their hand, you pay to get it. And that time wouldn't be the best time for you. Okay. Let us avail ourselves this good opportunity to access this vaccine at no cost.
All right. Well, it's 10:47. It's COVID Talks on Omega 101.7 FM, my radio, your radio. My guest has been Mrs. Nkechi. She is the State Immunization Officer in Anambra State. And our focus this morning is on COVID-19 vaccination and the vulnerable persons with disabilities and the elderly. The program is audience participatory. What I mean by that, you are at liberty to call these numbers 0815 1017 777 or 0907 112 1017. If there are questions on access, or because that's where I'm actually headed, we want to look into the accessibility of the vaccination to those that really are focus of the conversation. It's actually around that's talking about persons with disabilities and the elderly. 777. Now over to you, Mrs. Nkechi. You said something about going to religious places of worship, going to the traditional rulers. What happens? Because under our focus this one is really for persons with disabilities and the elderly. How has the vaccines been accessible? Let's talk about accessibility to the vaccination. How has it been for persons with disabilities?
Okay, for persons with disabilities, this time, good 18, our government is really trying in terms of whatever support, whatever resource, whatever good thing they bring to the people, especially as far as their health is concerned, they will do their best to take it to the grassroots. So these vaccines, this time, in this phase of vaccination, because initially we were doing it more of facility-based, but in this round of vaccination that is going on now, we are doing it more of mobile outing. They move out to reach to the people. They move out. They go to marketplaces. They go to shops. They go to churches. They go to where there are festivities where they can get a lot of people or crowd of people to vaccinate them. So our people are moving around. For disabled people, they are moving around. And even as a matter of fact, in any local government area you are in Anambra State, and you are in need of this COVID-19 vaccination, in there with you in your ward. In your ward, that means your ward in which you are residing. So it wouldn't be a difficult thing to access it. Call the OICs or the health officers in charge in the different wards, in the different primary health care facilities in your locality that you know. They can come to your house and inject you because of the disability, because you cannot move around. So that wouldn't be a challenge.
Dear customer, you have exhausted your extra value bundle and your calls will now be charged.
All right, I will sincerely apologize for that. Let's get back to the conversation. Okay, over to you, ma'am. I'm listening. Hello?
Okay, I am saying that we have mobile teams moving around in the different communities in our states. They are moving around with COVID-19 vaccines.
Okay.
And ready to immunize any person that indicates interest. You know, it's not by force.
Yes, it isn't.
So, how do you know them? Or how will you reach them where you are? In any community in Anambra State, you have ward. And these vaccines are there in the ward. So that means if you are in Oka South Ward 2, just ask around to get it. Or if you have the phone number of the LIO of your local government or the director of health of your local government, just call the people on the phone. Please, I have a challenge that I cannot move around. This is where you are. How can I access vaccine?
Okay.
And the things that are moving around can reach you and give you the vaccines.
Okay.
Because we have mobile teams.
All right. Okay, at this point, right now, I'm just going to be asking the question because during your discourse, you mentioned most of your challenges. Let's finally and conclusively talk about strategies for helping older adults and people with disabilities access COVID-19 vaccines. Well, we are live on Facebook. You can get to us at Omega 101.7 FM. We have their number state immunization officer, Mrs. Nkechi Onwuvunka, ask all COVID-19 related questions. Over to you, Mrs. Nkechi. Hello?
Hello?
Yeah, I asked the question. I said at this point, let's talk about strategies for helping older adults and people with disabilities access the COVID-19 vaccines. What strategies would you deploy in helping them? Over to you.
I think that was what I just said.
Yes.
That we have mobile teams that are moving around in different communities.
You have 1 minute remaining.
Okay.
Yes, we have them in churches on Sunday. The person can access it in churches on Sundays, and the person can also access it in the community where he lives because they are moving around. But if they cannot see any person around him or her, he can call or send somebody to the local government area of his origin, or where he is residing, and get the phone number of the director of health or the LIO, and they can be able to know where he is and how to locate him and give him the vaccine.
Okay. All right. So get to your wards. As she had stated earlier, the vaccine is accessible. If there are questions, send to 0815-1017-777 or reach out to their number state immunization officer, Mrs. Nkechi Onwuvuka, if you have issues or persons with disabilities and the vulnerable, the aged, those that also have developmental issues, please reach out to their number state immunization office and officer, Mrs. Nkechi Onwuvuka, would be there to attend to you and your what's the word now? The issues actually that have actually posed a threat. But as she has stated, there have been several myths surrounding the COVID-19 and the vaccinations, which we are here using the radio as a medium to disabuse completely completely. The fears are all over. COVID-19 vaccinations are very effective. There are no side effects. Even as we had stated time and time again, that some persons, most of the time, they have this myth. There have been lots of speculations, from individuals and from other sources, of various sources. But right here on the program, COVID Talks, Mrs. Nkechi Onwuka has actually disabused and actually brought our minds to rest. So for those living with disabilities or those with developmental issues, please reach out to the Anambra State Immunization Office and Officer, Mrs. Nkechi Onwuka, here in Anambra State, and ask all COVID-19 related questions. And at this point, we would wrap up on the conversation, and of course, definitely next week, Friday, the program makes a return. It's still Omega 101.7 FM, Ma Radio, your radio. Coming up at 11 would be the flashback edition of the late Mega Morning Show. Good morning.
Onye ka ọ na-esere gị na ya?
Ọ bụ nwunye m. O kweghị m ṅụọ mmiri tọgbọ iko maka ịgba ọgwụ mgbochi COVID-19.
Ọ bụ na ịgbabeghị ọgwụ ahụ.
Mụnwa tụfịa akwa siri so ịgba ọgwụ ahụ buru ibu. O nweghị onye ma nke bụ eziokwu.
Papa Ebere, gọọmenti agaghị ebutere ndị nke ya ọgwụ adịgboroja.
Nke ahụ bụ eziokwu. Cherekwa o, nwunye m gwara m na gị na di ga-agbago ọgwụ ahụ. O nwere ihe mere unu na akwụkwọ mba?
Mba, o nweghị. Mana ịma na ahụ dị iche iche. Ọtụtụ ndị gbagoro ọgwụ a, o nweghị ihe mere ha. Mana ụfọdụ nwere ike inwe obere ahụ ọkụ na ahụ mgbu ebe a gbara ha ọgwụ a, mana ụfụ ya bụ nwantịntị oge.
Mba, nke a abụghị nsogbu.
Ihe ka mkpa bụ na ọgwụ a ga-echekwakwa gị n'ezinụlọ gị na ndị nọ gị nso ibute COVID-19 nakwa ikesa nje ahụ.
Mama Ada, ị na-akọwa na ọ bụrụ na anyị gbaa ọgwụ a na anyị ga-enwe nchekwa ma gbochie onwe anyị na ndị ọzọ?
Ọgwụ a bụ maka ọdịmma onye ọbụla. Ọtụtụ mmadụ agbago ya.
Imeela Mama Ada, mụ na nwunye m ga-eji gbaa ọgwụ a ugbu a.
Ndị be anyị, ọgwụ mgbochi COVID-19 bụ n'efu. Ọ dị mma, dị ire. Gbaa ya ugbu a ka ị gbochie onwe gị na ndị ọzọ. Ma chetakwa ka ị na-akwọ aka gị na-eyi mkpuchi imi na ọnụ, na-enye ohere ma gị na mmadụ nọrọ.
Ozi a si n'aka National Orientation Agency site na nkwado UNICEF.
Papa Ebere, na who you dey quarrel with?
No be my wife. She no wan allow me rest with this COVID-19 vaccine.
Oh, you never still go take am?
Me? No. Mama Ada, with all this story we no know which one be true.
Papa Ebere, government no go bring vaccine wey no good for im people.
Na true you talk, but to come home, my wife say you and your husband don't take am. E no do una anything.
No, e no do us anything. But every person body no be the same. Many people wey don't take am no get any wahala. But some few people fit get fever, body pain, then for where they give them the vaccine. But e dey small and e no dey last.
That will not be problem now.
The important thing be say the vaccine now to protect you, your family, and people around you from COVID-19 and to stop the spread of the virus.
Mama Ada, so if we take this vaccine now, we go dey safe and we go protect others too?
Yes, the vaccine na for the good of everybody and plenty people don't take am.
Thank you, Mama Ada. Me and my wife go take the vaccine now.
COVID-19 vaccine now free. It is safe and effective. Take them now to protect yourself and others. Also remember to wash your hands, wear face masks, and observe physical distance.
This message now from National Orientation Agency with support from UNICEF.
What are you waiting for? What are you waiting for? Yeah, yeah. What are you waiting for? What are you waiting for? Millions of Nigerians have received COVID-19 vaccine. I have taken my own. What about you? We have taken our own. What about you? I am strong and healthy. What are you waiting for? What are you waiting for? We are strong and healthy. What are you waiting for? What are you waiting for? Go get, go and get your job. The hospitals, churches, and the mosques. Go and get your job. Health centers, hurry up now. Don't be late. Go and get your job. Bye bye, Corona. Bye bye, Corona. Get your job. Bye bye, Corona. Bye bye, Corona. Yeah, we care for Nigerians. We have come to the end of the matter. Stay safe against Corona. Hurry up now, make haste now. Ensure you get vaccinated. Up to 18, go get vaccinated. Use Pfizer, Moderna, AstraZeneca, Johnson & Johnson. Go, let's go now. Go get your job. Go, let's go now. Go get your job. Go and get your